EECP stands for Enhanced External Counterpulsation Therapy. EECP treatment is a registered trademark of Vasomedical USA. It is US FDA approved for the treatment of cardiac patients. It helps to increase the blood supply to the heart muscles by increasing the collateral network. Let us now understand how this treatment is administered. It is for a period of 6 weeks where we give 35 sittings for 1 hour daily. It is a OPD procedure where the patient comes to the clinic for a period of 1 hour. The patient lies comfortably on the bed. After lying down, the cuffs are tied around the calf muscles, the thighs and the buttocks. Electrodes are placed over the chest to give us the ECG. There is a sequential inflation and deflation which is timed with the ECG. Graphs are taken to see the progress of the treatment. This happens for a period of 1 hour daily. At the end of the treatment, the patient experiences improvement in his symptoms of chest pain, angina or breathlessness. EECP treatment is evidence-based and US FDA approved for treatment in the following cardiac patients. The first group is the patients who have already undergone a bypass surgery or an angioplasty and repeat procedures are not possible in this category. The second group is the patients who have been advised surgeries but are at a very high risk. Their heart pumping is low, so EECP treatment can benefit them, make them better so that they are able to undertake the surgeries. The third group is for the patients who are mentally not prepared to undertake the surgeries, or they are stable with medical management and surgery is at a later date. This is also an important group which can be benefited by the EECP treatment. EECP treatment is very beneficial to heart patients. First and foremost, it is non-surgical. There are no scars, there are no cuts, there are no wounds, there is no hospitalization. So naturally, the patient is in a very good state of mind and body. There are no antibiotics, there are no infections and there are no complications. Coming to the cardiac part of it, the patient has certain symptoms like a chest pain or a breathlessness or a fatigue. With the EECP therapy, there is improvement in the symptoms of these patients as the collateral network increases. The success rate of EECP treatment world over, which is documented, is more than 85%. Coming to the parameters like the clinical tests which are conducted, there is improvement in the ECG, there is improvement in the stress test performance, and also there is improvement in the 2D echo in the selected cases. Even the stress thallium studies have shown improvement in the myocardial perfusion. Thus, EECP is a very beneficial therapy with almost no or minimal side effects, maybe like a skin irritation due to the cuffs or little backache, but it is negligible. In selected cases, EECP treatment is equivalent to CABG, especially the cases where the pumping of the heart is very low and these cases cannot be operated. It has been documented that the increase in myocardial perfusion through EECP treatment is kind of equivalent to CABG. Also, there has been a study done where for a period of 5 years, 3 groups of patients were followed. The patients who were asked to do a CABG were divided into 3 groups. The first group just did the medical treatment, the second group underwent a CABG, and the third group underwent EECP therapy. After 5 years, when the survival rates were measured, it was found that the patients who had taken only medical treatment only 78% has survived. Patients who had undergone CABG, 89% has survived. And the patients who are undertaken EECP therapy, 88% had survived. This study almost revealed that EECP therapy is equally beneficial. When a patient undergoes an angiogram, the triple vessels are revealed where you can see blockages of 70 to 90% in the major coronary arteries. But in this angiogram, the smaller vessels are not revealed. If we do a test which is known as thallium scan or a PET scan, we can assess the flow of blood through these collaterals also. So, in EECP treatment, the before and after studies of stress thallium or PET scan has clearly demonstrated that there is an increase in collateral blood supply and there is increase in myocardial perfusion. As the angiogram only depicts the structure of the arteries of the heart, the function of the heart can be measured by various tests. Treadmill test is a simple non-invasive cost-effective test where if there is improvement in the exercise tolerance, it definitely means that there is an increase in the collateral blood supply. Apart from this, there are other tests which is dobutamine stress echo where the patient lies down and the echo reports reveal that there is improvement in the contractility of the heart muscles, indirectly signifying that there is improvement in the collateral network. Also, the thallium scan and the PET scan also shows the increase in perfusion, which again signifies that there is improvement in the collateral network. In EECP treatment, in 35 sittings, 1 hour daily, we are increasing the collateral network. Lifestyle changes is very important in each and every patient. Even if we look at a coronary artery bypass surgery, the grafts which are placed also can get reblocked if the risk factors are not controlled. Similarly, it has been proven that the efficacy of EECP treatment is for 3 to 5 years. But we have done studies and noticed that if the patients follow the lifestyle modifications where they are strict on their diet, they give up smoking, they do regular walks and are able to manage stress well along with the correct medicines, even in them the recurrence is hardly 5%. So almost 95% of the patients do not have to repeat the therapy if lifestyle changes are followed. At IPC, we do case selection for the EECP treatment. Every heart patient who approaches us for treatment, we do thorough evaluation in terms of the symptoms, their investigations and their clinical examination. There are certain cases where we cannot give EECP therapy. The cases are where there is a severe leakage in the aortic valve or there is aneurysm, that is abnormal dilation, or there is a very severe peripheral vascular disease where we could not generate a counterpulse. So these are the parameters which we see. Sometimes the patients have like a very severe spondylosis or a compressed disc and sciatica, which can also hinder the treatment. There are relative contraindications like which can be corrected, like the patient has got abnormally high blood pressure which can be controlled with medicines and given. There are patients where there are irregular heartbeats, the rhythm is not correct. Again, we can medically manage them, control them and give them. So there are cases where immediately we may not be able to start, but we give them good medical management, control those factors and then give them ECP therapy. The bottom line is that we care for each and every patient who come to us and only administer the treatment to the patients who will be benefit. and not do treatment to the patients who will be harmed by that. EECP treatment has been extensively researched and it has been concluded that it requires 35 hours of the total treatment to induce effective collateral network. I'll just give you a similarity, like for a child formation you require for a full term baby 9 months. Similarly, even in the heart there are big arteries and there are small arteries which we call the capillaries. To bring about the effective improvement in the collaterals, a certain amount of counterpulsation has to be given on a daily consistent basis to bring about the significant effect. So 35 sittings is actually the minimum. Many times the patients who are having cardiac failure or having severe form of disease may even require more number of sittings. And since it is safe and non-invasive, it has got a good repeat value also. We have seen that patients with low EF, we often repeat once in a year or once in 3 years to control the disease better. So EECP is very safe, effective and beneficial for the cardiac patients. EECP therapy is for 35 sittings 1 hour daily on a OPD basis. Every day the patient comes in for a period of 1 hour where this treatment is administered. Most of the times patients expect that how soon would I get or see the improvement. It depends on case to case. We have seen that some patients feel very good right from the first sitting, somebody from the third sitting, but on an average we have seen that majority of the patients start seeing the benefit after 10 to 12 sittings. Even in the first sitting also, like many times we have seen that patients who come on a wheelchair or not even able to walk for 2 to 3 minutes, they start walking better, and in 3 to 5 sittings they are almost able to climb the first flight of stairs. Now why this variation? Because the native collaterals are different in different people. Like I'll give you a similarity. Like if you see the hair, some people have got thin hair, some people have got thick hair. So similarly, all of us may have a small network or a big network. We can't see the way we can see our hair. So the response varies from person to person, and that's why we are talking of success rate of 85% or 90%, because if there are not much adequate native collaterals, even after EECP treatment the patient may not benefit, but that number is very less. As I told you that majority, more than 90% of the patients are benefited symptom wise or in some or the other form because of the therapy. During the EECP therapy, because of the machine getting a heart attack is not documented. In fact, EECP treatment is US FDA approved for treatment in acute myocardial infarction. So that is in the treatment of heart attack. So EECP itself does not induce a heart attack. Many people also think that when we are giving the counter pulsation, whether the blockage will shift or move to a different point, or a blockage will rupture and cause a heart attack. These are only myths. Nothing like that happens. We have done more than 5,000 cases of EECP treatment and there has not been a single death on table. If at all anything happens anywhere, it is just a mere chance. It had to happen. It is not due to the EECP machine or the treatment. EECP treatment does not remove the blockages. Like a bypass surgery also does not remove the blockages. In bypass surgery, through the grafts, we are circumventing the blockage. Similarly, in EECP treatment, we are increasing the blood supply to the heart by building up the collateral networks. So it does not remove the blockages. So very often the patients ask a question that should we repeat the angiography and see? No, there is no need to repeat the angiography and see after an EECP therapy. International EECP registry at Pittsburgh have documented almost 5022 cases for a period of 5 years, and they have noted that EECP therapy benefits for the period of 3 to 5 years, and in the patients who do not follow the lifestyle changes, almost there is a 20 to 25% recurrence. If the patients are following lifestyle changes, the recurrence is almost nil or minimal. EECP treatment also has a preventive aspect. As EECP treatment is safe, non-invasive, there are no scars, cuts, wounds or complications. It could be taken up even by a normal person who wants to prevent heart disease. Because the more the collaterals will be developed, the patient is able to live better, longer, and even if say there is age-related blockages or a heart attack, because of the collaterals, the chances of survival are better, or even later on in age when the blockages are developed, may not even require a surgery because collateral network is very good. Also, it is used by basketball players, sportsmen to increase their efficiency. That is what we call endurance training. So, EECP does have a role to play on the preventive aspects, but it is not explored as much vividly worldwide as it is done for the therapeutic purposes. The atherosclerotic process, that is stiffening or the hardening of the arteries, which happens in the heart, the same can happen to the brain also. ECP treatment is documented to increase the blood supply to the heart and to the brain also. It does not remove the blockages of the brain, but the increase in blood supply to the brain can benefit the nervous system also. EECP treatment is given in cardiac failure, that is where the heart muscles pumping is low. As we give EECP therapy, if the cells of the muscles of the heart are in the living condition, then due to increase in blood supply, we have seen documented that there is increase in ejection fraction, that is the pumping capacity of the heart. Let me explain you. The normal pumping capacity of the heart is around 60%. Generally, because of a heart attack, the heart muscles get damaged and the pumping capacity reduces to maybe 30 or 45%. In very severely damaged cases, the pumping goes down as low as 15 to 20%, which puts the patients into high risk category. We are treating all these categories of patients through EECP therapy, and we have noted improvement in the ejection fraction if there is a viability in a myocardium. Now this viability is found out from a test which is known as thallium scan, where we assess that which cells are living and dead. So in the patients where the cells are dead, there may not be improvement in the ejection fraction or the pumping capacity, but whatever muscles which are there is increase in blood supply, but there is no improvement in ejection fraction. So patient should not conclude that since my pumping capacity has not increased, I have not benefited from the treatment. There is a benefit to the treatment. And the patients where the cells are living, there is definitely improvement in the ejection fraction. We have seen cases that where the pumping was 15%, 25% has jumped to 30%, 45%, and many times to our surprise, it has also come to normal. EECP is for enhanced external counterpulsation therapy, which is the trademark of Vasomedical USA. This means that this is the only system which is US FDA approved for the treatment of cardiac patients. There are other machines which are known as ECP, that is external counterpulsation manufactured, and all of them do not have the US FDA approval. Now what does this mean? While administering this treatment, there are a lot of finer aspects which determine the efficacy of the treatment. The most important aspect is the sequential inflation and the deflation of the cuffs and the timing with the ECG. In the therapy offered by Vasomedical EECP, it has been documented and proven that these timings are so fine-tuned that the counterpulse which is generated and the graphs which we get are very accurate, and it has a documented success rate of over 85%. No other machines or systems have this kind of documented clinical trials done for the therapy. So this makes it the best system in the world to treat the cardiac patients. IPC is in technical collaboration with Vasomedical USA for EECP treatment. We are also the largest providers of EECP treatment and have done maximum cases through various centers all over the country. We are the founder members of the EECP Expert Committee and have also formed the Indian EECP Patient Registry on the lines of International EECP Patient Registry at Pittsburgh in association with other cardiologists and cardiothoracic surgeons. Now, this is very important because there are strict protocols to be followed, and each and every case is registered in this Indian EECP Patient Registry. So, we select the cases and we believe in giving an honest medical opinion. Every case which comes to us, we thoroughly evaluate, and anybody who requires surgery is immediately guided for the same. But the good part is 90% of the patients can be saved from invasive surgeries. We take upon these cases with clear indications, and the patients which cannot be benefited or are contraindicated, we even reject the same. Because very often patients feel that whenever they go to any facility which is offering any particular treatment, as soon as they go, they will be immediately told to join upon. That is not the case at IPC. We take up cases only which will be benefited by the treatment, and there is a very open, transparent policy where each and every case is told right at the beginning through our expertise and our experience that how much the patient can expect from the treatment, and most important, what the patient cannot expect from the treatment. Because very often the patient do not know about the procedures and they have their own mindset of what could they achieve and or get from the treatment. So at IPC, we are very clear on all these issues, and most important, along with the ECP treatment, we offer a unique patented cardiac rehabilitation program which helps the patient to go to the root cause of the problem. Like one can see that there are a lot of bypass surgery hospitals, and every hospital has a machine which does help the surgeon to do the bypass operation. But why is it that certain surgeons are preferred? It is because of the technical skill of the surgeon. Similarly, very often patients always feel that okay, this facility is near me, this machine is near me, after all it is a machine which is going to do the treatment. No, that's not the case. The machine may be the same, but ultimately it is the technical expertise of the doctor in the case selection, in the quality monitoring, and that is what we have mastered over the 15 years of pioneering experience at IPC. We have a qualified team of dedicated professionals who are almost doing the ECP treatment right since it is introduced in India. And most important, we have got the largest follow-up data in the entire world, where we have followed up our cases for 10 years after ECP treatment, and we have seen fantastic results in them. So I think it is very evident that whatever work we have done, we want to share our success with you, and we want maximum patients to be benefited by treatment of EECP at IPC.